What a great success story, and Dr. Bradley Eichert is part of it. He's from Cone Health. He's joining us right now. He's a doctor of osteopathic medicine at LeBauer Pulmonary Care in Greensboro. All right, we just heard that story. Pretty amazing that she was diagnosed, treated, cured of lung cancer basically in a day. I'm sure almost unheard of. The survival story started with what she talked about was a simple, painless screening tool. So what is that? Let's talk about it.
Yeah, so lung cancer screening is for anybody that has been a current smoker or a former smoker, has quit within the past 15 years, and has a 20-pack year history of smoking. So that's our group of patients that are high risk for developing lung cancer, and it's a great tool for catching lung cancer early.
Okay, so just even asking those questions, that's kind of the screening tool. Okay, gotcha. So is lung cancer screening only for smokers?
No, it can be for anybody that has been a former smoker, and also recommended within the past, if you've quit within the past 15 years.
Okay, so that's the criteria if you're a former smoker or you've quit within the past 15 years. We hear something like this word called pack year. What does pack year mean?
So that's the number of packs of cigarettes smoked per day times the number of years. So if you're between the age of 50 and 80 years old, have a 20-pack year history, and have either a current smoker or quit within the past 15 years, you're recommended to get lung cancer screening.
Okay, so if a viewer is hearing this and thinking, okay, I meet that criteria or I'm close to that criteria, but I feel fine, do they need to have anything done?
Absolutely. Majority of lung cancers are asymptomatic at the time of diagnosis. And that's why screening is so important, because earlier we catch lung cancer, sooner we can do something about it. And I think that's the most important thing to remember, is that lung cancer most of the time is asymptomatic at diagnosis. So we want to try to catch it early, and screening is the way to do that. It saves lives.
Okay, so when we're talking about this screening tool, does our regular primary physician do that, or do we go to a specialist for that?
Yes, so we have a lung cancer screening program here at Cone Health that primary care providers can refer to. Patients can also self-refer to. They have information can be accessed through our website, which is at conehealth.com/lung cancer screening. But yes, they can be done both at their primary care office or through our lung cancer screening program.
Okay, and so can we kind of like walk through some of like the screening things, like what's next, what's next? Is there like a scan or an x-ray or anything like that involved?
Absolutely, absolutely. We start by making sure patients meet criteria. They could talk to one of our coordinators for that. And then they're scheduled for a visit with one of the providers, and then appointments made for their CT scan.
Okay, so the CT scan then shows kind of what we saw in the story when they could actually see something on there.
Yeah, absolutely. The CT scan is a low dose CT, which means it has less radiation than a traditional CT. It takes less than 10 minutes to do. It's painless, and it's a very easy screening tool.
Okay, we're going to continue on this conversation. Some of the tests, there's dyes that are used and things of that nature, so we're going to get into that, and we're going to talk about that when we come back.